Alrighty, gang, it's 4:30 on the drive home for a Thursday. Wayne, Tanya, and Brian all alongside.
Indeed.
And we are blessed and lucky to have great guests join us this afternoon. Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital, who always provides a great conversation and a wealth of information, which is exactly what we need right now, facts and information. And Dr. Jennings, welcome to the show. How are you?
I'm good, sir. How are you guys?
Pretty good.
All right.
Doing well, thankfully. Fingers crossed, knock on wood, everything so far is good with us.
Mm-hmm.
We should start out, Doc, by talking about, obviously, today, the second largest number of new cases reported by the Illinois Department of Public Health, 2,563, and 141 additional deaths. And 91 of those up in Cook County, for those keeping track of that. And so, but still, a whole lot of new cases.
There are, but again, I'd like kind of a little bit like we talked about last time. Some of that's a little artifactual because, as we know, they've been working very hard to ramp up the number of tests being performed, and I believe they performed over 13,000 tests as well.
Mm-hmm.
So actually, we're seeing those numbers pop up, and so with that, you're gonna detect more because we do know there's a portion of people that are asymptomatic or minimally symptomatic that aren't requiring hospitalization, but are now having the opportunity to be tested, and so with that, you're going to see additional positives. So I don't think that's cause for alarm. I think what it's going to help us to do is get a better understanding of how much is actually out there in the communities so that we've got a better handle on our ability to start talking about loosening up restrictions and those types of things.
Excellent. And so with the number, so the number of tests being performed, more tests is good, right? That's what we should have.
More tests are good. There's a problem, though, as you know, and that's when you still have more tests but not enough tests. You're still caught in this kind of catch-22 of I've got additional information that we've got more positives out there, but sometimes, again, that's artificially increasing the number of positive cases, and as those people aren't necessarily being hospitalized, so they're not the sick of the sick. I don't have enough to test everybody to get a real handle on it, and so you're kind of in this no man's land right now, which is why you've seen them ramp up these testing centers in certain areas where they're trying to get more of a handle on local disease prevalence and not putting as much effort into communities that aren't quite as big of a hot spot. So it's helpful. But again, it doesn't necessarily guide clinical care when you start increasing the number of tests of especially asymptomatic people. It usually just kind of does what it's doing here, which is causing people to pause around the idea that things are starting to improve in a clinical situation where you have fewer people in the hospital and those types of things. So it muddies the water a little bit when you still don't have tons of testing. If we can ever get to the point that we got lots and lots of testing and testing on demand and those types of things, well, then it's pretty slick. But right now, that's just not the case.
So, Doc, as you know, tomorrow here in Illinois, some big changes set to take place. Obviously, the stay-at-home order is still in place, but some changes around the state. Some parks will be open. People will be allowed to shop with retail stores, be it phone-in orders or online orders. A lot of additional restaurants will be open, and also the requirement for people to wear face masks in stores that they're not wearing face masks in now, big box stores and things like that where they can't keep 6 foot apart. What's your thoughts on this, the changes set to take effect tomorrow?
Well, I think they were trying to kind of strike a middle ground there with increasing the requirements around masking. So, again, you try to reduce that idea that if you're an asymptomatic carrier or you cough, sneeze, et cetera, and you're in the vicinity of someone else, that mask should capture those droplets and stop those things. So I think putting the mandatory masking thing in place then potentially allows you to open up into a larger number of businesses and things so that, okay, now we can be in more places, but the trade-off for that is you've got to do something to contain you from cough, sneeze, et cetera. So I think they tried to thread the needle here. Whether or not that'll pay off for us in the end, I guess the time will tell. I saw lots of comments around the fact that, some of these smaller stores have fewer people in them all the time than are required anyway, and keep a distance as opposed to the big box stores. And so, so there's some thought around that as well, which I think is appropriate. But if you go with the masking requirement and the idea that should reduce spread from person to person, then that should give you more freedom to open up some of these other activities. So I think they tried to thread the needle.
Now, did I hear the governor correctly that elective surgeries are going to be able to be scheduled starting tomorrow, or?
Starting May 11th.
Okay.
So they came out with some additional guidance, and in fact, we're expecting an update any time right now on the guidelines that were published a little over a week ago, or this past weekend, I guess, on how to proceed with that. Of course, it's first contingent upon how much disease is in the community and whether or not you have adequate hospital beds, adequate ICU beds, adequate ventilators, all of those things. And of course, in spite of the uptick that we saw within the county, we've been very fortunate that the majority of those have not ended up hospitalized, et cetera. So we're well positioned in aspects related to availability to move forward safely and have adequate resources within the hospital, because you're not using all of your PPE and all that extra support that you need taking care of hospitalized patients. So that's the first step to decide if you're ready to reopen. The second part of that then really gets to creating committees that review the priorities to make sure that, that those people that are at the greatest risk of complication and delaying their surgery any longer get highest priority to get restarted around this. And so all hospitals and surgery centers are required to create a committee to take a look at the prioritization of cases as they reopen. And they've recommended a slow ramp up, that you start with maybe 20-25% of your normal type of volume until you can find out for sure, what goes right, what doesn't go right. In addition to mandatory testing prior to surgery of all these folks within 72 hours. So they'll be tested 72 hours or within 72 hours of their planned surgery, and then asked to self-quarantine until the time of their actual surgery, so that they don't pick it up, hopefully, in that 3-day window. So we're looking at a soft opening, for lack of a better word, around May 11th. In fact, my committee, as soon as I'm off this phone, is meeting this evening to start to try to work our way through what a prioritization looks like and how to try to take a closer look at those things that are out there, because there are definitely differences. Obviously some stuff's easy. Cosmetic things could wait a long time. Some of the stuff for follow-ups for people that have had a cancer diagnosis or something that have delayed certain follow-ups, now it's probably time to be getting that stuff done. We've already lost 6 weeks. So,
right.
So the docs are going to be helping us to devise a strategy to do that. And then at the same time, figuring out what the workflow is within the building to move patients as safely through the facility as we can. And then, of course, adding the guidance around testing, et cetera. So many layers go into this, but at the end of the day, what the governor's looking for, and what I'm positive that we'll have created, is a safe environment to resume this testing. To resume these types of procedures and start to take care of some of those things that unfortunately have had a delay.
Well, you just mentioned one main topic there, Dr. Jennings, and that was elective surgeries and related type of things. But there's a lot of services that St. Anthony Memorial Hospital provides for the community and the region and all that. I know a lot of people would really like to see things like visiting hours reinstated for whatever the number of people that are actually still patients in the hospital. Plus the convenient care part of HSHS. You just mentioned elective surgeries. There's a lot of other things out there that would be part of, the grand scheme of things. And you just outlined a lot with the elective surgeries. Is it basically the same type of thinking for a rollout of these other things? Just whenever a safe environment can be ensured, that's when we'll see some of these things, whenever that is?
You're directly at it, exactly. I mean, the idea is that, we're looking at beyond surgery, at exactly those services, at outpatient physical therapy, the diagnostic centers scattered throughout the communities. And some of those are going to start reopening now with some limited hours and trying to do more scheduled testing and type things to try to make sure that you have as few people as possible in waiting rooms and things like that. So, so being able to go ahead and get people back in there, but not crowding into a small space and creating a secondary problem unintentionally. And even having folks, come if they check in, if they're able to maybe go wait in their vehicle for a little bit until the next patient's ready to go, and then we can call you and have you come in and do your test. So kind of changing up the workflow a little bit around that. The visitor restriction piece is incredibly frustrating and painful for everybody involved. And right now the guidelines, even in related to the surgery restart, the IDPH guidelines still recommend either a prohibition where you just don't allow any visitors at all, or if you are going to allow support people for a variety of reasons, sometimes someone can't communicate for themselves, then those folks should have some screening to make sure they don't have fever, respiratory symptoms, et cetera. Given the prevalence of disease that we've seen in our community, our intention right now, in spite of that little bit of guidance, is to go ahead and allow a single support person, basically leave our current restrictions where they're at until we get a little bit more time and see how these things flow within the building before being able to hopefully see some guidance from IDPH allowing us to lift some of those restrictions, and then we'll be following suit, of course. But we've gotten lucky at this point, and we certainly don't want to do something that would set us backwards.
And Doc, to touch on something that you just brought up here real quick, the visiting hours and the whole effect that this has on people psychologically, not just for the hospital, but you think about the nursing homes out there with people who are used to having families come in on a very regular basis. This has been, I don't think I'd be overstating it to say it's been traumatic on a lot of people.
Oh, it definitely has. And, we've tried, where we can to take advantage of technology and allow people to either FaceTime or use some of the other, meeting type apps, Skype or Zoom or whatever, and provided iPads and things like that to patients in the hospital so that they can continue to visit if they're, able to, and that type of thing. But, and again, we've still allowed, occasional visitors based upon a specific clinical scenario where it was important, for more than the norm, whether that's an end-of-life type situation or something else where you just, it's just so incredibly difficult. The nursing home requirements are actually even more harsh than what has been put on the hospitals at this point. And of course, you see these outbreaks popping up pretty well left and right in those congregate living facilities, so it's understandable why. But you are right. The emotional toll that this has taken on both the patient, the families, and even the staff, because they're asked to then pick up the ball for family, and that's hard to do too. And some of those stories get very difficult to hear.
All right. Brian, you got anything else?
One quick thing, just because tomorrow is, like you said, Wayne, somewhat of an introduction of the masks. Not the full explanation, Dr. Jennings, but any quick tips regarding the use of masks, since these are going to be probably a little more prevalent, and they have become more. I mean, I've started to use them. We're going to see that for some time. Whether everyone does or doesn't is a whole nother question. But just in regards to using masks or cleaning them or when to wear them, any quick tips or suggestions on that, Dr. Jennings, or anything that you hear is wrong and you want to clarify? Anything briefly on that?
Sure. Really, the biggest thing, and Lord knows I've played with enough of these at this point, and we're still incredibly grateful for all the mask donations, all these homemade masks that people have dropped. We did have our container blow away in the storm the other night.
Oh, no.
Where'd it go? So there weren't any masks at the time, but it vanished. I think it went to Kansas. And, so there were some folks asking about where did the container go. It is back out there because we definitely still need these masks. Following one of any of the patterns out there, but we have a pattern on our website as far as creating your own. is really great. Use a breathable fabric. I know the tight knit cotton really does do a nice job and does a great job with not allowing moisture to go either direction. We had some that are made out of like fleece and things like that. That's hard to breathe through. So what we don't want is people putting something over their face, especially folks that may have less than optimal breathing to begin with. They've got asthma, they've got COPD, and then they're putting something on that actually restricts their breathing. So they want to find a breathable fabric, and in some of those situations, just a scarf type thing, a cotton scarf may be easier for them to breathe through than a mask. As far as cleaning them, I still think your best answer is making sure, that you stick with cloth, and then you're able to launder it. If and when disposable paper masks out there become more available. Right now, those are hard to come by. Then, of course, the paper masks are a reasonable substitution, and you just dispose of them once they become wet. But laundering, just a cloth mask is probably the best option right now with the shortage of those types of supplies. But breathability is important. I do have some concern that folks start wrapping stuff around their face. That's hard for some folks. Sometimes just a sheet's all that you care to breathe through. So just be aware of that, and of course, just keep them clean. Just keep them washed.
There you go.
Sounds good.
And Doc, right around tax time, I have to tell you, bringing up laundering is not what we expect. Masks is the last thing we'd expect to launder around tax time. So there you go.
Who knew? I'm still trying to not do mine. I'm just going to pretend they just get away with that for good.
Yeah, I see. Right on.
Work out for me.
Yeah.
Taxes and COVID can both go away.
Yes.
There we go.
Anytime.
All right, Doc, as always, so good to talk to you. Thanks. You're a wealth of information. We appreciate the time.
My pleasure, and thanks again to WXEF for getting us on.
Anytime. Thanks. There you go. There's Dr. Ryan Jennings, the Chief Medical Officer at HSHS St. Anthony's Memorial Hospital. Always great to talk to him.